Good afternoon, everybody. Thank you so much for joining today's webinar, which is hosted by the National Coalition for Infant Health. I do also want to recognize the partnership with the National Foundation for Infectious Diseases for today's webinar as well. I apologize, my phone was ringing over here. Today's webinar will review the key points from a recently completed national survey about perspectives on maternal and infant immunizations. I'm Susan Hepworth. I'm the Executive Director of the National Coalition for Infant Health, and I am very pleased to be joined by Dr. Flor Muñoz. She is an Associate Professor of Pediatrics, Infectious Diseases, Molecular Virology, and Microbiology at Baylor College of Medicine, and she is also a board member of the National Foundation for Infectious Diseases. I'll give a few brief introductory remarks, and then I will do a review of the survey highlights. Upon the conclusion of the survey highlights, I will turn it over to Dr. Muñoz to deliver the expert survey analysis. We've also saved time at the end for Q&A before we wrap up. About the coalition briefly, the National Coalition for Infant Health is a collaborative of professional, clinical, community health, and family support organizations. And the mission of the coalition is really to prioritize education and advocacy that promotes patient-centered care for all infants and their families. So whether an infant is born preterm or full term. Other core areas that the coalition focuses on includes infectious diseases, vaccine and immunization access, mental health, nutrition, and safety and innovation, among others. So with that, we'll go ahead and start on the review of the survey highlights. So this survey was conducted online in November 2024, shortly after the November presidential election. The survey looked at attitudes generally about immunization, awareness about different methods of both maternal and infant immunization, and then the sources of information and education that women look to when making decisions about immunization. And then the survey concludes with an expert analysis, which of course we'll be hearing from by Dr. Muñoz in just a little bit. And the demographics are outlined here on this slide, and I will just call your attention to the upper left, which is key. It was 300 women were surveyed. 62% of them had a child under 2 years of age, and 38% were pregnant. And of that 38%, 33%, about a third, were having their first pregnancy. So when asked about their attitudes towards vaccines and immunizations, respondents reported that 43% listened closely to their doctor, but also did their own research. 36% indicated strictly following their doctor's advice, with 13% relying mostly on their own research. And then 8% did indicate choosing not to be vaccinated at all. More respondents reported prioritizing getting their child vaccinated over getting themselves vaccinated. So you can see 75% said they did prioritize vaccines for their child, while 61% prioritized vaccines for themselves. Respondents were also asked about different types and methods of immunization here. So we can see that overall awareness was pretty high. 77% said they were aware of immunization methods that protect both the mother and the infant, with 76% being aware of vaccines that protect infants. 71% were aware of vaccines that protect pregnant women. But much lower, significantly lower, was awareness of preventive antibody immunization method for infants, and that is specifically related to the RSV infant immunization. I will also call out that, of course, there is also a maternal vaccination for the protection of infants for RSV. As it relates to maternal immunization, 49% indicated receiving all of the recommended vaccines during pregnancy. So that's less than half. Less than 1/3 said they received some vaccines, with 18% receiving no maternal vaccines and 6% were unsure. I also want to note here that 78% indicated that their healthcare provider did recommend maternal vaccines, but 15% said they never received any kind of a recommendation. Respondents were asked about the likelihood of receiving vaccines during pregnancy that also protect their infant after birth. 55% saying they would be more likely to receive that vaccine, knowing that it also protects the infant after birth. 29% said they would be just as likely to receive it. Interestingly, 9% said they would be less likely, with 7% unsure or preferring not to say. I will also note here that among the respondents who said their child received no vaccines, after learning that there are vaccines given during pregnancy that can also protect the infants after birth, 20% did say they would be more likely to receive those vaccinations. Women who did not receive any vaccines during pregnancy noted several different reasons here, including 47% being concerned about reactions to vaccines, 36% saying they did not trust the manufacturers of vaccines, 25% said that they were not advised by their doctor, 24% said that they do not think vaccines are necessary to protect against diseases, 21% cited a distrust of the government, and 20% said religious beliefs. I'll also call out here that 6% said they were unsure where to go to get vaccinated, and then 5% did cite out-of-pocket costs as a concern as well. Moving on to infant immunization, 65% of respondents said that their child received all recommended vaccines, 27% only receiving some, and 6% receiving no vaccines. And respondents cited these reasons for their child not receiving all recommended vaccines, a little bit similar to the maternal side as well. 50% cited concerns about side effects, distrust of the manufacturers. 27% said they were not worried about complications of diseases. 26% said they did not even believe that their child was at risk of vaccine-preventable diseases. 19% reported a previous negative experience with a vaccine. 14% saying vaccines aren't necessary to prevent disease. And 10% also did say difficulty getting an appointment. Religious belief and cost concerns were also mentioned, as well as not believing that vaccines even work. Respondents were asked if knowing that a preventive antibody, which I mentioned earlier for the prevention of RSV in infants, it is not technically a vaccine, but still immunizes the baby against an illness, would make them more likely or less likely to have their baby receive it. 28% indicated they would be more likely to have their baby receive it. 25% and 13%, really no change in opinion there. 10% say they would be less likely, but 23% indicated that they would follow the recommendation of their healthcare provider. One key piece of information that we were interested in learning about was when mothers made the decision about immunizing their child. And as you can see here, 49% indicated that it was before even getting pregnant, they had already made the decision to immunize or not to immunize. 15% said during the first trimester, and then another 10% at the pediatrician's office during well child visits. When asked to rank who they trust most to get information about vaccines and immunizations, respondents said the most trusted was a pediatrician or family physician, followed by a nurse or nurse practitioner. An OBGYN, number 4 came in at a public health authority, followed by family members at number 5, partner and spouse, and then a pharmacist as well. I would note that religious leaders, social media influencers, and political figures did rank the lowest of all of those options. And when asked about what sources other than their healthcare provider would inform their decision about vaccines and immunizations, respondents noted these. 63% said CDC guidelines, 55% said online searches, 39% educational pamphlets from a healthcare provider, 38% some type of a healthcare website, 29% family and friends, and then ranking pretty low there would be the manufacturer's websites. We'll also note similarly here, social media influencers and podcasts were among the responses ranked the lowest. And I think this chart is really interesting that respondents relied on different sources of information about immunization. And we broke that out among those who said their child has no vaccines versus their child has all vaccines. You can see that for children who have no vaccines, there is a greater reliance on online information versus that of a healthcare provider, which is relied on more for children who have received all vaccines. So this concludes the review of the survey results. So I'm going to invite Dr. Muñoz on to do the expert analysis.
Thank you so much, Susan, and thank you everyone for joining us today. As Susan mentioned, I'm a pediatrician, I'm an infectious diseases physician, and I have the pleasure to be part of this analysis as a member of the National Foundation of Infectious Diseases. And I think, just to start, I would like to share with you that this is a very important evaluation, a very important survey that has given us information at a very critical time when it comes to vaccine prevention of diseases. This is because we are at a time when we have had an emergence of diseases like whooping cough or pertussis, which we have seen increasing since the end of the COVID-19 pandemic, and that we have seen not just being a cause of respiratory symptoms in children, but also now even deaths in very young infants who usually are only protected either through their maternal vaccine or their own vaccinations, which start at 2 months of age. Maternal vaccines are very important, and we know that we are protecting both the mother and also protecting the babies. And that is, again, the very typical example of whooping cough. But we know that there are other diseases like flu and COVID, where we can have the benefit of protecting infants in addition to the mother, who tends to have usually complications from these respiratory infections in the third trimester. Nevertheless, the coverage or the uptake of the flu and COVID vaccines have also decreased over time, along with that of pertussis. So again, I think this is a very informative survey because although the number of participants is small, and you might have some communities that are not fully represented, it does allow for some generalizable information that can be applied when we communicate about vaccines and these important diseases. So what you can see here is that there are a lot of moms who are aware of the recommendations and the availability of the vaccines that are given during pregnancy and also for their children. And you need to remember that the vaccination in pregnancy is not anything new. We have been vaccinating women for flu since the 1950s, approximately. We have been using tetanus vaccines as well since the 1960s or so throughout the world. And certainly everyone will remember the flu pandemic in 2009 with H1N1 virus that actually resulted in a greater uptake, more interest in vaccinating women during pregnancy, because we did see the effects that a new strain, in that case H1N1 flu pandemic, was having in pregnancy, especially in the third trimester. Shortly after that, we had in 2012 the recommendation of giving the whooping cough vaccine in the form of Tdap or TDAP to pregnant women because it is the most direct way to protect infants against pertussis. And, pertussis or whooping cough was a disease for which we have pediatric vaccines, and we have been giving them again since the 1940s or so with very good efficacy in preventing disease in children. The problem is that we can only start at about 2 months of age to give the vaccines, and that is because the babies are not able to produce good immunity on their own, good antibodies on their own. So by giving the vaccine to the mother, that antibody is passed through the placenta and is able to allow those babies from birth to have that protection. And this is a time that is critical because whooping cough is a disease where even though most of us can get it, it's only if you get it in the first month to 3 months of life that you can have more severe consequences and dying. So what this is, what I've just told you about pertussis is passive immunization. So it's giving the antibodies directly to the baby by means of vaccinating the mother. The baby is not getting the vaccine, the mother receives the vaccine, and the baby receives those antibodies. As you have also heard, there are now also new prevention tools to give this passive immunity in the form of an antibody to babies from birth and in the first few months of life for a new respiratory virus, which is respiratory syncytial virus that causes severe disease, especially in the very young, in the first 3 to 6 months, and for which we don't have, in this case, any other vaccination. So to me, when I see the data that we have seen today, it's a little bit troubling that you see that half of women who have the option to receive these vaccines for themselves and for their babies choose not to be vaccinated during pregnancy. And also, when you look at infant immunization coverage, it's about a third of those babies are either incompletely vaccinated or not vaccinated at all. And so this is a missed opportunity to prevent these diseases for which we have these very effective and safe vaccines in both pregnancy and infants as well. The next slide, please. So I think, again, going back to the opportunities. So I think that there might be a number of issues here when you look at how to address gaps and that could help improve our immunization coverage. I think that overall, focusing on education is going to be very relevant. I can see how there are potentially different sources of the information on vaccines. And many people like to do their own research. Many people like to receive the advice of their physicians. And I think that maybe one important point here is that it's okay to do your own research and to do your own evaluation of the recommendations. But it's important to make sure that the source that you seek for that information is a source which is qualified to make those recommendations and verified and be able to confirm that the information that you're receiving is going to be accurate. Another opportunity is making sure that vaccines are accessible to mothers and to the infants. And it was only a very small percentage that said they had trouble maybe making an appointment or they didn't know where to receive these vaccines or antibodies. And we do need to think about that and focus on access. But, many times consider what would be the reasons for that. I think we are very fortunate in this country to have full availability of vaccines, many places where vaccines can be obtained. Yet, sometimes schedules and work and other social conditions, might be a reason why we have access that needs to be addressed. And then further than that, I think it's important to make sure that the experience on vaccination is a positive one so that with the information, with the proper access, moms are able to really reinforce the fact that the benefit for themselves or for the infants is the goal and that they're well prepared and informed to have a positive experience with their vaccination. The next slide, please. I think, again, here's another set of conclusions from these survey. It seems that most mothers are going to make their decisions about whether they or their infants are going to be vaccinated very early. So many times, even before they become pregnant or they know that they are pregnant. And so I think that in this case, being able to provide this information or facilitate the availability of information regarding these diseases and the effect they can have in the mother and the baby, and also the availability of the vaccines is critical. Many said, for example, they did not know that these vaccines existed, or they did not receive a recommendation. So it's very important to have that very early on when women are considering pregnancy. It's also important, as you can see, to have very clear, consistent, reassuring messages. I did see some questions regarding safety, and I can tell you that for many of these vaccines, as I mentioned, we've had experience for decades, and we have very good safety surveillance systems in place. And these vaccines are indeed considered to be safe and effective, and they do protect against the diseases that we are seeing. And especially because the reason we know that is because you see that as we have a drop in the coverage and the uptake of these vaccines, there is now an increase of some of these diseases. So I think for us as healthcare providers, it's important to address the concerns that mothers would have for themselves and for their babies regarding how safe or efficacious the vaccines are. And then finally, regarding the communication here, I think addressing misinformation is going to be critical. I think that you could see there that there were maybe more concerns and maybe mistrust in the sources of information that could be driving the decision to receive the vaccine or not. And certainly in the current environment of the accessibility of data that comes from, again, so many different sources, many platforms out there, social media, television, radio, there's different ways when we can hear information coming along. Making sure that, again, you have a very reliable source, a qualified source, and that you have a good understanding of the information that is available. Go for different sources of information even, and make sure to ask questions. I think that your healthcare providers who continue to have your trust are going to be the ones that could confirm or address some of these concerns that you might have. Next slide, please. So I think that here, I just wanted to conclude, there are different important points that come out of this survey. Certainly, the survey shows that empowering parents with accurate information is going to lead to better outcomes. And also empowering healthcare providers to regain the trust of their patients is going to be important, because as you can see, there are many concerns regarding trust in general and perception of risk versus benefit. And so I mentioned, the ability of having different sources of information, but I think it is the role of many to be able to have this support to our healthcare providers to be able to provide the services that our patients need. Certainly, I think that we need to understand a little bit more what are the different factors that influence the decisions that parents make about their vaccination in their children, and certainly mothers in their own vaccination. These types of surveys are, showing us a snapshot on what is happening, and having them occur over different periods of time or a long period of time might allow us to see what the trends are. And again, I would mention the point of perception. So perception changes, perception of the risk of a disease, perception of the risk of the vaccine, perception of the benefits of the vaccines might change over time. So understanding what are the factors, why are these perceptions changing, is important to be able to direct, again, our messaging and to be able to have good communication regarding the vaccines. So I think that one of the last words I'll just say is consistency in our messaging. We have evidence-based information for many, many years with the use of these vaccines. They're not new. We know that they're safe and effective. And I think that being able to harmonize our message is also going to allow for more accessibility and being able to have equity again and making sure that all of our mothers and babies receive the benefit of being protected against these vaccine preventable diseases is very critical at this time. Slide. Thank you.
Thanks so much, Dr. Muñoz, for that. We've gotten a bunch of questions in here. So I just encourage everybody to go ahead and use the Q&A button to put those questions in. And then I want to start out with a couple. Dr. Muñoz, for you. Do you think that there is a need for greater awareness and education about the impacts of flu and COVID when a pregnant woman gets flu or COVID and what that impact could be on her baby?
Yes, so flu and COVID are interesting because they are seasonal respiratory viruses. Um, so meaning they come every year. For COVID, maybe even twice a year, we have potentially new strains. Um, we know that for both of these respiratory infections, most of us are going to have a milder illness and we're going to be okay. But we also know that there are some groups that are at greater risk of having complications. And it's impossible to predict who is going to be okay and who isn't. But among those groups that are at greater risk, we know are pregnant people and young infants. And, of course, other individuals with comorbidities. So if you're pregnant, but you also have diabetes or you have asthma, for example, that could also increase the chances that you might have complications. And although it doesn't happen in the higher numbers that we saw during the pandemic, we still see that, pregnancy can be complicated by flu and by COVID in some cases. So I think that being able to share that message for the mom's own health is very critical because obviously a healthy mom means a healthy pregnancy and a healthy baby. So having flu or COVID in the second, third trimester of pregnancy can result in preterm deliveries, can result in babies being born a little bit smaller, or other complications in the mother herself with pneumonia, etc. So again, we are looking at something that uh, it's perceived to be rare, yet it happens. And you would have the opportunity to not be the person who has this complication with the use of a vaccine. So the main message I would give is that the vaccine is meant to prevent the severe cases, the complications of these infections in the mother. And then it has the additional bonus benefit of passing this immunity, this passive protection to the baby when we don't have vaccines for babies for either flu or COVID until they turn 6 months old. And yet this is the greatest risk for the babies as well for complicated disease.
Thank you. I also want to ask, and you talked a little bit about this on the slide on opportunity to address knowledge gaps, talking about greater education. Um, how it is that you think we can help families to understand the rigorous evaluation process that all vaccines and monoclonal antibodies have undergone, and how is it that we can help them understand to trust the recommendations that are made by healthcare providers and other healthcare officials.
Yes, I think the COVID pandemic was an opportunity for many people who usually are not involved in vaccine development or, understanding how vaccines come to be available to us and healthcare providers, how it works. So we a lot of people were able to see that in real time as vaccines were being discussed and highly anticipated. Um, but I also think that we have the luxury again to have a very open system where the process has been delineated. Clinical trials must occur. There are rigorous criteria for a vaccine to be licensed for a particular group. And then there are experts that make recommendations on the use of those vaccines. And all of these discussions are open to the public. There's advertisement about this occurring. You can log on and watch it in YouTube and be able to really, be able to see it yourself. So that became very apparent during COVID. But I think that in addition to that, maybe another piece that is not obvious to people is that vaccines today are much safer than they were maybe 50 years ago, right? So the technology has also advanced in addition to the rigor of the assessment of the vaccines and the criteria to be able to have these vaccines approved. And one last point is that even when a vaccine is available and already we are using it, that's not where it ends. There are also safety systems in place so that there is ongoing assessment of how well the vaccine works. Is it doing what it's supposed to do? We all anticipate the data on, the efficacy of the flu vaccine, the efficacy of these RSV prevention strategies, and also on safety, because this is a commitment that exists in our health system, right? That we'll be able to identify any events. So we have everything we need to be able to use these vaccines and to be able to know how they're performing in real world. And I think that as much as we can, share this information, make sure that it is transparent, and hopefully will give reassurance to the public.
Thank you. All right, several more questions here. Someone asks, are you seeing a trend towards greater hesitancy as of late?
I think we are, yes. And I would say I am, in the sense that I'm following the numbers. Um, Hesitancy, even in the context of outbreaks, as I'm in Texas, and we see that, for example, with the measles outbreak. It's an outbreak that could be, first of all, could have been prevented with vaccines, and then could have been stopped sooner with more acceptance of vaccines. I see the trend in increased hesitance by the fact that I'm getting reports on babies having pertussis from our laboratory. And I had not received these reports for many, many years, from 2012 until just during the pandemic, the COVID pandemic, because there was good uptake, and we were not seeing those cases. Now they're happening again. And then, just in terms of the discussions that we hear often and the concerns that maybe you see in social media and different groups with some reluctance of receiving vaccines, mainly because of trust and perception. I think that would be probably where I will sum it up. And this is why it's so important to have the proper source of information.
Thank you. This is a really good question. I'll be curious to see your reaction. It seems that messaging from healthcare providers will need to be stronger than ever, considering the new emphasis from HHS on vaccine being a quote personal choice, or where you're hearing shared decision making as well, which can cast doubt on vaccine safety and the risk-benefit balance. Are there messaging or communication strategies that are being developed to strengthen healthcare providers' vaccine recommendations and increase families' trust in the importance of vaccinations?
Well, first of all, let me say I agree. It's more important than ever to have a consistent and strong message regarding vaccines. I think that all of you who are in healthcare know very well that one of the big successes of medicine, probably the biggest, it has been disease prevention through vaccination. And we see that when we're faced with a new disease. We were faced with COVID, we had to get a vaccine. Maybe that's not the greatest example because it's a virus that changes so much, but here we are, with a number of other outbreaks of diseases throughout the world. And we know that a vaccine is basically mimicking your responses to having had the disease without having the disease. So it's giving you that protection. And so I would reinforce the fact that this is nothing new. that we've become maybe complacent because precisely of the success of vaccines, because we don't see these diseases anymore because we've been vaccinating. And having a strong message and being a advocate for immunization, I think is a duty for all of us who work with vulnerable populations like children who are at high risk for some of these diseases, like pregnant people or those that have comorbidities, older adults, all groups that actually are going to have a higher risk of diseases that maybe we have forgotten about, pneumonia vaccines. There's just a number of diseases out there. So it is our duty to make sure that it's not forgotten that we have the availability and the tools to prevent not just the infection and the complications, but death. And I think that more than ever, you know, as we see numbers come up, it's going to be important to report those. I think maybe that would be a way. I can't tell you about any specific tools being developed other than existing tools that we know have been there for many, many years and available to us, educating about vaccines. But in addition to that, I think that it will be important to highlight when we see these outbreaks, when we see these infants with these infections, these mothers suffering from complications. We need to make sure that it is clear that this could have been prevented.
Yeah. And I could just mention that from the coalition's perspective, one of the things that we are continuing to work on, and I will use the RSV example here. Yes, we have now a maternal immunization. We have an infant immunization. I think there will be another infant immunization that potentially comes on the market this year as well. And that is wonderful. But one thing we are continuing to focus on is talking about the burden and the impact of RSV so that people do not become complacent and think, well, it's not really circulating that much, so I don't really think it's important for my child to receive that immunization anymore. So we're making it a priority to continue to tell the family and the personal impact stories so that people, not to scare anybody, but just so that it remains top of mind that, okay, even though there's been a significant reduction in hospitalization because we have these new prevention options, I still need to take it seriously and protect my child. So, yeah. Just a couple of more questions. I think this is an interesting one. So, Dr. Muñoz, I guess, how would you prioritize the maternal vaccines given that mothers are unlikely to get all of them? And I think that is an interesting question.
Yeah, vaccines are recommended for a reason. As a pediatrician, we get asked the same question about children. And unfortunately, people come up with their own schedules and their own priorities. And I advise against that for mothers or for babies, because the reason we have gone through all of that process, of developing a vaccine, of having guidance, recommendations, and knowing when to use them is because they are filling a need. And the need is to prevent a disease that is important for those groups. We wouldn't have a vaccine if we didn't have a burden of disease in mothers or a burden of disease in children. And they're recommended in a certain way because of data. And so I think that, just like we have many vaccines for children, and they're given at a specific times to try to protect the children when they need it the most, the same concept it needs to be applied to pregnancy. So we have 4 vaccines in pregnancy. All of them are important. Ideally, I would like to emphasize that all of them should be received and it shouldn't be a choice. Certainly, there's differences, right? So the COVID and the flu vaccines are seasonal. So just planning around the season when this is happening. And the importance of understanding that these viruses change, so the vaccines might change. So maybe you were vaccinated in the past and now you have the option to get another vaccine when you're pregnant. It's probably a vaccine that will be more specific for the viruses that are going to be around. So this is why it's important to get those, because it's more directing to what is you're going to be exposed. And then the pertussis and the RSV vaccines, which pertussis is given every pregnancy, RSV is given in your first pregnancy, or if you've never had it before in a pregnancy, you can get it now. Really, the main goal there is to protect the babies. And those are timed based on when the baby is going to be born to make sure that the babies have the highest protection possible at birth. Certainly, RSV also is timed around when the season is going to be because it's a winter virus. So I would, unless you have a contraindication in pregnancy, or maybe you missed a window, I would really emphasize the importance of trying to get all the vaccines administered during pregnancy, and that you don't need to get them all at the same time. There's different timings and you can plan ahead. Just talking to your healthcare provider, your antenatal care provider, to how to organize your visits and antenatal care visits to be able to receive them would be key.
Great. Well, thank you so much, Dr. Muñoz, for joining us today. I've had a couple of questions. Will people receive these slides? We will be sending out a recording of the webinar just within the next week or so, so you will receive those. And again, Dr. Muñoz, thank you so much for your expertise and sharing your insights with us today. And thank you, everybody, for joining. I hope everybody has a great rest of their day.